Hi, everybody. Thanks for joining us this afternoon. We will be starting the event shortly. As a reminder, this event will be recorded. So please be prepared to turn off your cameras and your microphones, and we will be starting here shortly. Good afternoon. It's right at the 12 o'clock hour. Welcome, everybody, to the Staff Council event. I am about to start the recording, and we'll be starting here very, very shortly.
Is it okay for me to do a quick mic check and ask, can you all hear me okay?
Oh, hi, Dr. Walker. Of course, please do.
Okay, excellent. Thank you.
Reminder, the event will be recorded. Please turn off your cameras and your microphones at this time as we prepare for the presentation. All righty. Hi, everyone. Good afternoon, and welcome to Staff Council's Workplace Conversations series. I think we're doing a few mic checks. I want to make sure everybody's okay and prepared and ready to go. All righty. I wanted to welcome and thank our UH Staff Council leadership for helping us host this event. We're very excited. I also want to take a moment at this time to take a moment of silence to acknowledge the pain and suffering that we've been experiencing as a campus and our UH community. As you all know, we've had some recent unfortunate events with the passing of 2 students at the University of Houston. So if we can just take a moment of silence and bow your head just to express our sympathy for those losses at this time. Thanks, everyone. Again, welcome to the Staff Council's Workplace Conversation Series. We're very excited to have all of you here. The Staff Council DEI Committee uses Workplace Conversations as a platform for both UH staff and community to engage in educational opportunities and discussions around diversity, equity, and inclusion, DEI. Please follow us on social media at UH Staff Council for upcoming events. We're very excited to have you all here. Our story this afternoon will be a dynamic conversation with women leaders who will discuss how they practice self-care, resilience and stress in the workplace. Again, friendly reminder, please turn your cameras off. Today, we want to get comfortable, get engaged, and hear stories from these inspiring women. So hopefully everybody's all settled in and ready to go. We're really excited about today's event. Please help us to welcome the DEI committee member and moderator for the panel, Monique Wiltz. But before we do that, I did want to share a little information and welcome our staff, our DEI committee staff. Thank you to our staff council leadership. As you see here, we're very excited and honored to work with our staff council leadership for the DEI committee. And also, thanks to our UH Staff Council Diversity, Equity, and Inclusion committee, and they're all shared here on the slide. We've had an amazing committee in hosting this event and planning for this event today. So thanks very much to our DEI committee.
Can you share the slides?
Yeah. At this time, I'm going to stop sharing. And I want to introduce Monique Wiltz at this time. Please help us and welcome Monique Wiltz, who will be our moderator for this afternoon. Monique is a program director in the Office of Retention and Education and Graduation Initiatives and leads our first year retention efforts at the university. Welcome. Thanks for being here, Monique.
Thank you. Mic check. Can you hear me, Debbie?
Yes, I can hear you fine.
Everyone? Okay. Awesome. Thank you so much. Thank you, Debbie, and good afternoon, everyone. Thank you for taking the time, your lunch hour, most likely, to be with us here for this important conversation. I am honored to introduce these amazing women. I will read their bios, and then I want to allow each of them about 2 minutes to introduce themselves after I give this brief introduction. So without further ado, I will start with Dr. Rheeda Walker. Dr. Rheeda Walker is a clinical psychologist, award-winning professor, and a leading scholar who has published more than 60 scientific papers on African American mental health, suicide risk, and emotional resilience. Dr. Walker's impact has expanded beyond academia with the release of her first book, The Unapologetic Guide to Black Mental Health. Dr. Walker debunks myths about mental health, builds the case for psychological fortitude, and delivers practical advice for use in everyday life. Her charismatic vision and practical approach to life's challenges has led to numerous appearances on Good Morning America, The Breakfast Club, and NPR, just to name a few. Her expertise has been cited in the New York Times as well, the Washington Post, the Los Angeles Times, and the Houston Chronicle, among others. So let us welcome Dr. Rheeda Walker.
Good afternoon. Good afternoon. Thank you so much for that warm introduction. Also, thank you so much to the UH Council and the DEI committee for organizing this conversation. One of the things that I guess would help as we think about this context of the story is to say something about how I got to this place. I am someone who's a first generation college student. My mom said to me very early on, you will have to choose between being a lawyer and being a doctor. And I thought, oh, okay. I thought that's how things went. And I thought that I would be a lawyer because I like to actually talk. And what I realized at some point, I think this has relevance for how we think about resilience and how we think about stress and how we manage life, is that we don't all have to fit into this one size fits all. And we each have to be aware of what works for us and what doesn't. And what I realized was that law wasn't going to work for me either. And what happened was that I realized as an undergraduate student that it was psychology that I was most intrigued by and most curious about. So I thought, okay, well, I guess I'll get one of those PhD things. Again, no idea what that was as a first year or first generation student. And fast forward along, I observed in my work, because I was most interested in African Americans and the psychology of depression for African Americans, that there was a presumably looming crisis that no one was talking about. And so again, I've just paid attention to the signs, paid attention most importantly to what worked for me and what did not work for me, so that I could honor my own size rather than trying to fit into a one size fits all of who I had to be as a successful individual in life. So I look forward to saying more about that. And again, thank you all so much for the invitation to be here.
So much, Dr. Walker. Our next panelist, I have the pleasure of introducing and reading her bio, is Dr. Erika Henderson. Dr. Henderson has more than 30 years of experience leading organizational efforts to recruit, develop, and retain the best and the brightest talent in higher education and federal government sectors. She serves as Associate Provost for Faculty Recruitment, Retention, Equity, and Diversity for the University of Houston. Dr. Henderson previously served as a Senior Policy Advisor to the U.S. Department of Labor's Assistant Secretary for the Employment and Training Administration. Prior to that role, she was the Deputy Director for the White House Fellows Program. As a native Houstonian, she holds a doctorate in higher education from George Washington University, as well as a Bachelor of Science in Business Management and a Master of Arts in Counseling, both from Hampton University. Dr. Henderson serves on the Mickey Leland Kibbutzim Board and the editorial boards for Insight into Diversity magazine, which is the oldest and largest diversity magazine and website in higher education today. Let us welcome Dr. Erika Henderson.
Thank you for the wonderful introduction, Monique. It's a real honor to be here, and I look forward to engaging what I think will be a really wonderful conversation.
Our next panelist that I have a pleasure of introducing is Angela Cox. Angela is a Director of Federal Admission System Sales for Matrox. She has worked in the technology sector in the capacity of business development and sales for 25 plus years. During her time in corporate America, Angela has focused on developing and deploying technology infrastructures to support secure, low latency video distribution networks for federal organizations such as NASA, the Department of Homeland Security, and the Department of Navy, just to name a few. In her free time, Angela serves as a board member for the DePaul School of Dyslexia. She loves traveling and spending time with her family and their dog, Maple. Let us welcome Angela Cox. And Angela, if you would like to say some words. If not, I can introduce our next panelist. No worries. Absolutely can. Sure. Our next panelist is Laura Ortman. Laura Ortman is Cologix Chief Executive Officer, and she serves on the board of directors. Laura has over 25 years of experience in cloud and technology global leadership, focused on the go-to market strategy, revenue growth, global customer success, sales and account management, and revenue and client relationship management. Laura is a recognized leader in the industry, receiving a leadership award from the Professional Business Women of California for her commitment to supporting women and girls in technology. Laura serves on the Cologix board, the Digital Edge DC board, the advisory board for the University of Colorado Boulder, Lead School of Business, and on the alumni board and College of Business Dean's advisory board for the University of Alabama, Huntsville. Laura holds an MBA in Information Systems from Regis University and a Bachelor of Science in Business Administration and Marketing from the University of Alabama in Huntsville, where she played tennis as an NCAA college athlete. Let us welcome Laura Ortman. Laura?
Thank you, Monique, for that wonderful introduction, and Debbie and the entire staff, council leadership, and the DE&I committee for having me here and being part of this conversation on health and wellness. I'm truly honored to be part of this panel amongst these amazing women leaders, and certainly extending my thoughts and prayers for the entire University of Houston community as well. To share a little bit more about me, I grew up in Houston, graduate of Clear Creek High School for those Wildcats out there. I've been residing in Denver for the last 26 years, and really throughout my career journey, the last 25 years in both business and technology, having that sense of belonging and inclusion has been extremely important to me, and why I continue to hold DE&I as one of my top leadership priorities. I also want to set that example for my two daughters and girls who aspire to be in business and leadership, and really show them why personal wellness and balance is important. And sometimes you have to make some tough decisions in order to continue to have that personal focus. So thanks again for having me here.
Thank you, Laura. Were we able, Angela, able to come back? Okay. Okay. Okay, great. So as we wait a little bit for Angela to come on, there she is. Perfect timing. See what amazing women do. Perfect timing. Hi, Angela. Welcome, welcome, welcome. You're muted. Awesome. I did read your bio, Angela. Would you like to say a few words?
I
before we
will.
get
Thank you
started?
for organizing this to begin with. I think this is such an important topic, and to be a part of this group of dynamic women is an honor.
Thank you. All right. So at this time, everyone, we want to dive further into our guest experiences with some questions. It's what everyone is here for, right? Related to
Yeah.
our topics.
Real
Right.
quickly,
Of self-
before you go further, Monique is our moderator. I'd like to ask Dr. Walker if she could.
Yes. There we go. Thank you. Thank you.
Got the engagement with all the questions from all of our panelists. Thank you.
Yes. Thank you, Debbie.
Okay. Mhm.
So we want to dive into some questions related to our topics of self-care, resilience, and stress in the workplace. Please notice the chat feature at the top of your screen. And if you feel inspired, please submit questions and comments there for the panelists. We will answer those at the end of our Q&A. So, all right, let's get started with the first topic of self-care. So question one, what helpful tips can you share on balancing work, life, and education?
Balancing work, life, and education is certainly not easy. When I got my MBA early in my career, I was working full time, and those were my priorities. It was a struggle at times, but I've learned over the years that you have to prioritize family. And so I've been a big believer from a leadership standpoint to put family first and my health first and wellness, to ensure that I do my best work both at home and in the workplace for our company, for our employees, for our customers and shareholders, but also for my family. So the last several years, I've really prioritized health and fitness and personal development. I've incorporated it in my daily work schedule. For example, I block my calendar during certain times of the day to really focus on my health and fitness. And then I also, block time to focus obviously on my work and my family, my professional development. And so one day doesn't always look the same as another, and that's okay. And, some weekends I'll focus on one thing or another, and as long as I can have that balance. And so for me personally, family and health always comes first. That's how I lead our organization. That's how we lead by example. And, certainly the work demand doesn't go away and continues to increase, especially with the pressures that we all have in today's economy. And we just need to continue to prioritize that as, family first. And I'll just give a quick example. Last year, I took a 1-month sabbatical. I've never done that in my career, where I really just took the time. I didn't go anywhere. I just focused on myself and my family for a month and didn't focus on work. And it was a great recharge. And when you have a strong team and culture and value system, your team and coworkers, love the opportunity to step up and do this for you, because they want to do their own, they want to focus their time too. So that was a big decision I made last year, and it was definitely worth it.
Thank you so much, Laura, for sharing that. Thank you. Would any of our other panelists like to respond for that question?
I was recently shared a tip, being present. So we wear all of these different hats. And as a result of the pandemic and working from home, work life and personal life have blended a lot. And someone made a really sound suggestion to be present where you are. So when you're at work, be focused on work and doing your job at work. And then when you're at home, be focused on spending time with your family and taking care of yourself, and try to separate the two and be present where you are at the time. So that's something newly I've started practicing the last 2 weeks, and I have felt so much better. So I would like to encourage you all to consider a simple kind of tweak in your thinking.
Thank you. Thank you for that, Dr. Henderson. So question 2 says, can you share your philosophy on self-care and some of your self-care practices?
I think I can start with that one. I can best characterize my philosophy as balance. Because we're always striving towards balance, recognizing that we may not always get to that perfection, but it's a goal. And as a clinical psychologist, I do start with assessment. So saying, okay, where am I today on a 0 to 10 rating? What is and I use the language of psychological fortitude. So what is my capacity even to be able to take care of my work responsibilities and, to be able to teach and to be able to take care of family and also myself, to tap into my life purpose. Like, we can all talk about all these different responsibilities and obligations that we have on a day-to-day basis. But if we can give a rating, so right now I'd say I'm hovering at about a 7.5 on a 0 to 10 scale of my capacity to be able to move forward on all or most of those things. Now, if I said my rating was at a 4, then I need to get back into a better sense of alignment. And so with that in mind, I may have to take some things off of my plate, or I may have to reach out to someone else for help in order to get me closer to, and I'll say closer to a 10, because 10 is a nice goal, but 10 is not a realistic goal, on most days. And so being able to first evaluate, see where I am, oftentimes we'll say to folks like, how are you doing today? And people will say, oh, I'm doing fine. Fine doesn't tell us anything. But that 0 to 10 rating is more of a, I guess, an objective, and I put objective in air quotes, more of an objective assessment, that if you're below a 7, then you probably need to make some adjustments. For those of us who may be at a 3 or lower on too many days, might need to get some professional help. So we first have to start with assessment, because, there are folks who would say, like, I'm not doing so well, but when I ask them for their evaluation or their psychological fortitude score, they'll say, well, I'm probably at about an 8.5. And I'm thinking, okay, so you're thinking you need perfection, because that might be a relatively lofty goal. So we have to start with assessment and then make adjustments, or at least that's what I do in my life. I make adjustments accordingly.
Thank you, Dr. Walker. I like that scale. I think I'm going to try that. Thank you. Would any of our other panelists like to respond?
I love what Dr. Walker said, and it reminds me, with us, we use a little different scale. We say, what kind of day are you having, red, yellow, or green? And we know if somebody has a red day, whether it's personal or work, we know not to kind of get onto them too much, right? Or, okay, it's yellow, but it's turning to green. But I love your assessment. I mean, that's a big part of that.
Thank you so much. Okay, our next question, how do you set and communicate your boundaries in the workplace? This is a good one.
I'm happy
You're
to.
welcome.
I mean, certainly I have a lot of good practice with this. I think it's all around, like you said, the communications and leading by example. And so people know that our culture is all around family first. And if you need to take care of something for your family, we've got a team that will back you up. And we've got a culture of what we like to say, together we win. And it takes all of us to win as a team. And so, not just saying it, not just having it as part of our value system, but leading by example. And if there's a situation and I need to focus on my family, I know the team will back me up and they know that that's a priority. Or if it's health related, same thing. So I think you set that example, but you lead by it as well. And it's a continued discussion, as part of our daily conversations.
Thank you, Laura. Thank you. Leading by that example in the workplace, not to divert a little bit from that question, but just to tack on just a little bit, what do any of you feel would be an example of leading in the workplace if you're not someone who is in a leadership position in the workplace? How would you do that? Or any suggestions with that?
No.
We can come back to that.
I try to treat people the way I want to be treated. And so that's kind of my golden rule, no matter where I've worked or what role I've had. And that's something that I try to practice. And I would encourage other people. Now, oftentimes I think we've all had colleagues who are kind of consistently on red and then want everybody else to be on red. So you just have to maintain a kind of healthy space around you. It's my fault.
Thank you.
Yeah, I think we've got a lot of our employees around sharing the things that they're doing, that it's helping them with their balance, right? So just sharing those stories with their peers and talking about it is I think how you set that example. If you're not in a leadership role, I think everybody's in a leadership role of some type, right? You all can lead by example, but it's really sharing those stories and learning from each other.
Thank you so much. Leading into our next topic, this question does, what is resilience? Your guide to facing life's challenges, adversities, and crises. So how would you define that?
It's funny, I feel that question was almost written for me. For those of you who don't know, the research team that I lead at UH and that I've led for the better part of 20 years is the Culture, Risk, and Resilience Lab. Because what we recognize in mental health is there are going to be adversities and things that happen. Like, that's just a part of life. Stressful things happen all the time. And what's most important is how you recover or rebound from the things that happen. And my dad used to say, if you stay ready, you don't have to get ready. And again, that's part of that balance. So if I'm hovering at about a 5 on that psychological fortitude scale, when things happen, that's going to tank my PF to about a 2. And so I am always mindful of trying to stay at about a 7, but that doesn't mean that I stay there, to be sure, because there's been some 4 or 5 days either that I'm not excited about, but that I'm honest about, so that I can say, okay, what is it that I do in fact need to be able to do to help me to be able to recover? I think that oftentimes we talk about like all these bad and stressful situations, and we just wish that stressful things didn't happen. But what is most important is to be able to build up or create for ourselves a repertoire of situation happened, what do I do? And so for me, it's things like, I might not run into the house right away. I might sit in the garage and listen to some music at the end of the day before I go right into the house. It's things like when I'm in the shower, Dr. Henderson talked about being present. So many of us, when we take our shower at the beginning of the day, end of the day, whenever it happens, we're going to work in the shower. Like, okay, what do I have to do? What didn't I do? And we go to work rather than being in the shower. We don't have to go to the spa to enjoy warm water or warm steam on our bodies. And so we all have to figure out, like, what are the things and in what situations and circumstances do we need to employ those things in order to get our psychological fortitude closer to that place of a 10. Sometimes we have to go a little bit deeper and write down like what's most aggravating about whatever the stressful situation is so that we can work through it rather than ruminating through it. So those are my thoughts.
Thank you, Dr. Walker. Yes, I'll be honest. We did think a little bit about you with that question. Would any of our other panelists like to say anything about resilience? No, we're good.
I can talk
All
to
right,
that for a
so
second. I think
sure.
finding something that you enjoy, even if it's just for 10 minutes. For instance, I love audiobooks. I love podcasts. Those are my go-tos. I rarely listen to music anymore. And it doesn't have to be an educational topic per se, but just something I'm interested in learning more on. And that keeps my mind focused on different activities rather than work or rather than home for a little bit during the day. And I find that to be very helpful.
So our next question goes into our next topic too of wellness. And Laura, I think you touched upon this in the beginning. What wellness programs would you recommend or currently participate in?
Yeah, I've got a lot of examples. I could probably talk about this topic for an hour, but I'll keep it to my time limit here. But so we created a group of employees, created this group called Culture Club, and it has no reference of Boy George, but it's the Culture Club, and they focus on the culture, they focus on wellness. So I'm going to give them all the credit here, but they've implemented a few things. So one is we implemented 2 wellness days a year where our employees can just take those days and focus on themselves. It doesn't matter what they do, they focus on themselves. We just ask them not to work. And so we've really kind of put that out there to support the team. We've also implemented what we call our volunteer program, where they get a certain amount of hours per year that they can do community service. Again, getting out of kind of their day-to-day and giving back to the community, to whatever organization that they feel passionate about. And then we put in a bunch of wellness, like we've got a lot of strong competitors at Cologix, and so we like competitions, and so we do wellness programs competitions. So we'll do a spring challenge and a fall challenge where you go outside and you share what you've done, whether it's mowing your lawn, apparently you get a lot of exercise doing that, or walking or biking, or just, enjoying the outdoors. And so that's been a lot of fun. We share pictures and we share stories. So we do that twice a year. One of the things that I'm currently doing with my team, so I did the 75 hard day challenge last summer with a good friend of mine. I finished it, talked about it with some of my coworkers, and one of our employees said, I want to do it. And this was in January. And I said, well, I'll do it with you to support you. And now we have a whole team of folks doing it. We're on day 59. We're still going strong. And, to really focus on our wellness. And that's, if you know anything about the 75 Hard Day Challenge, it's about wellness, but also personal development and getting the rest and the water that you need. And I could talk about that. But so that's a big thing that we've done. And then we've just focused a lot on employee engagement. And so, for me, it's not just wellness and the health and the well-being, it's also that sense of inclusion and belonging. And whatever it is, book club, pet challenges, we're doing the March Madness bracket. We do have a lot of employees that picked Houston to win. I did not, but that's okay. I'm still rooting for them. I'm wearing my red today. But just everything that we could do to help with that balance and wellness and well-being. So we put a lot of investment and focus across our organization on that.
Wow, Laura, thank you so much. That was a lot of good information. I love the way I'm still just thinking about it. Like, wow, I love the way it pulls into getting everybody at the workplace involved and committing to their goals, which are related to wellness. That's awesome. Anyone else?
Monique, I'd like to encourage all of my UH colleagues to take a look at a number of the benefits that you have available as a result of being an employee of U of H. Do you know that you can take an hour and a half of fitness release time every week? So you could take, for 3 days, you can get 30 minutes, leave, you could step outside of your office, go for a walk, perhaps think about adding it to your lunch and go into the rec center. The human resources team at U of H have lots of fitness related activities. You can take yoga, you can see. So please take advantage of all of those benefits. I think Debbie and I had a conversation where she's going to work with the folks in HR to make sure that this information is available. So please take advantage of all the great benefits that you have available to you.
Thank you, Dr. Henderson, for that reminder. And at the end of our session, at the beginning, actually, we had some slides. And Debbie, maybe we can definitely share that wellness slide about UH Wellness towards the end.
Dr. Henderson that are offered with the Power Up program with UH Wellness, HR Wellness. So happy to share that out, the PowerPoint and all the links to those resources that are available to faculty, staff, and students. So thank you.
Debbie. Thank you.
Yeah, thank you for that reminder, Dr. Henderson. So our next question, what are some of the methods and tips, and this leads to our next topic, to help to respond to stress in the workplace? Because we know it exists, we know it's there, can't run away from it. So what are some methods and tips you use to respond?
I can take a stab at that one. My first tactic is to try and prevent it. When responding to stress in the workplace, several things come to mind. And the first is how much workplace stress is actually workplace stress. What am I bringing with me from, my drive into work, or from my home life? The dog needs new food. My daughter needs dance shoes. It's a busy life. So after I thought about that for a while, I decided to take advantage of technology, and I automated as many activities and needs of my household as I possibly could. And it doesn't cost a lot, if any, extra, but I'm on a cycle. I don't have to think about it. We don't run out of anything. I'm not running out on my lunch break to get dog food or dance shoes. It's the little changes and the little pivots that I've made throughout the years that reduces my stress at work. And I can actually be present, as Dr. Henderson said, in my work and give my best. The other thing that strikes me is I tell my 11-year-old daughter frequently, we can do a lot of things, but we can't do all of the things. So let's be thoughtful about what we're committing to, and if we should be committing to those activities, whatever it is. In work, it might be a committee or a different team, or maybe the PTA, right? And am I in a position to take that PTA role or not? So I think just being a little more thoughtful about what will lead to a stress situation has helped me a lot.
Thank you, Angela, so much. Thank you for that, for sharing that. I've had that conversation with my own child. It was busy. Thank you.
I do something very simple, like get up from my desk, walk outside, and walk around the building like 2 or 3 times. And I find it seems to lift the cloud, and it also allows me to think much more creatively in terms of solutions. So just something simple. So if you all ever see me walking around the building, that's what that's what I'm doing. Just taking a moment to exhale. And I find that oftentimes I've gotten just lost track of the big picture, and a simple walk helps me regain focus.
Yeah, I would add, probably a couple additional tools for when things do happen, because as you all have mentioned, they do. And one is deep breathing. That sounds immensely simple because presumably we're all breathing right now. But deep breathing is a different level of breathing that does two things. One is it takes us out of the situation, whatever it may be, kind of like, like you're just saying, Dr. Henderson, like to get out of the situation. And so when you're focusing on your breathing, you're not thinking about whatever it was that just happened. And also, we've gotten lazy as adults about how we breathe. And so the most effective type of breathing, and for those of you who already do yoga, Pilates, and those kinds of things, you are already mindful of how you breathe. And it is different when you breathe diaphragmatically, which is more effective than when we do our just regular, like the doctor says, take a deep breath and you go, not very effective. So that's one thing. And I actually have a video on my YouTube channel. For those of you who don't yet, maybe follow me on social media. I'm on Instagram giving recommendations, and on YouTube and various places. I have a deep breathing video that is a 9-minute video. I could easily do a 30-minute deep breathing session. That's one thing. The other thing is, in fact, writing. And I alluded to that earlier, because oftentimes things happen in the environment, for those of us as women, for people of color, and you're trying to figure out, well, what did they mean by that? And what were they trying to say to me? And was it me? Did I do something? Am I too sensitive? And when you can take a moment to write down, like, this is what happened. These are my thoughts about it. This is what was most upsetting for me about that situation. I guarantee, because I've seen this work with our clients, our patients, and some of my own personal work. When you write down what it was that happened and what was most upsetting about it, it actually opens up the opportunity to develop more skills and strategies and to figure out how you're going to respond to the situation rather than just replaying it over and over in your mind, which I think maybe we do that because, we're smart people and you think, well, if I just keep replaying it, I'll figure it out. It doesn't actually work that way. But when we can get the situation or thing out of our head and onto paper, it gives us more opportunity to actually figure it out a little bit more effectively. So those are my thoughts.
Thank you so much, Dr. Walker. I have a lot of notebooks, and I feel good that I have my notebooks. Right on. Thank you for that. Thank you for all the tips. Thank you. Thank all of you. So we have one more question, and then please keep the questions coming in the chat because we're going to transition to that soon. So I want to encourage everyone, if there's a question you want to ask, please put it in the chat, and we will get it answered. So the last question for the Q&A, share a health and wellness experience of working through an event at home or at work.
I can share kind of a bigger thing that alleviated some pressure for me. And as I was talking earlier about the one size fits all, for those of you who aren't familiar, university professors move up in rank. So in a way that lots of folks move up in rank from assistant to associate to full professor. I happen to now be a full professor. Incidentally, I represent 1% of full professors who are Black women in the US, 1%. As an associate professor, I was working really very hard to get to that full mark. And so trying to get grants and doing all sorts of things that weren't necessarily consonant with my values or what I saw was important. But what was important was getting to that highest level of rank. And at some point while working on a big project, I literally fell out of my chair and ended up having to have back surgery. I was 40 years old at the time. It was insane. Like, who falls and then needs back surgery? But what that said to me was, I am doing way too much. And I'm pushing for this thing because somebody told me, well, you have to get to full professor. And I didn't necessarily have to do that. It was just something that I'd said to myself in my mind, kind of like my mom saying, you got to be a lawyer or a doctor. So when I pivoted and said, you know what? I can't do this right now. I'm literally harming my physical body. And at the moment when I thought, well, what if you never make full professor? For a moment, it was terrifying. But after that terrifying moment, I was able to say, like, oh, wow, I can just breathe and do things, other kinds of things that are important. Now, incidentally, that lasted for a couple years, and then I eventually went up for full professor. But I gave myself room to breathe by making an immensely difficult decision at the time because what I was doing wasn't working. And so oftentimes we have to take a step back and say, is what I'm doing working? And completely pivot, maybe take a month off with the family and say, I got to change this whole thing up, whether or not other people agree with it or not, because I have to make decisions for me.
Dr. Walker, and it reminds me of, I'm going to go bigger on this as well. When you have career goals, right? You have personal goals, career goals, you want to accomplish it all, right? And so I was in a situation where I had a great position with a great company. I was traveling about 90% of the time all over the world. And I didn't realize until another opportunity came my way to do something a little bit different. It would help me be at home more, for the balance of travel. And it was the time when my daughters were in middle school and they were just about to go into high school. And I thought, I don't want to miss out on some things. I mean, certain things that I don't miss out on, but when you travel 90% of the time all over the world and you're going to Asia and Australia and Europe, it all sounds great. But for business, as we know, it's very different. It really helped me take a step back to say, people from the outside may not understand why I'm making this decision. Like, why are you leaving this great role, great company, great position? But it was probably the best decision I've ever made in my career. And I was able to stay home and spend more time with my family. And I was still able to accomplish, from a career perspective, the things that I wanted to do and to make that level of impact. It was just in a different way. And so, I knew personally I was making the right decision. It was a very personal decision for me, but from the outside, people were thought, are you sure you really want to do this? And it was the best decision in my career to this day.
Wow, thank you so much. Thank you both so much for sharing that. This has been so much valuable information. I want to thank you, all four of you, so much for sharing just a lot of, your personal tips, your stories for us. We're almost at our 1 hour time, believe it or not, for this discussion, but we will take the questions from our chat for our panelists. If you do need to leave, thank you for joining us, and please be sure to check the UH Staff Council website for upcoming events. I will now have Erika present our questions from the chat. Erika?
Lean and Bauer. She's asking Laura specifically, but the other panelists, if someone wanted to pursue a sabbatical, how would you approach that discussion with your leadership?
Yeah, that's a great question, because I had to go through that process. I think if you work at a company or part of an organization where they support that, obviously that's easier. They've got the foundation in place. If they don't, I mean, it's a conversation that you have. And again, I mean, I've had peers that have taken 6 months off. I thought for me, a month was good. It wasn't just a week, because you're still de-stressing in that first week. So I figured I need to take that time. And it's just a personal conversation I had with my manager. And at the time, he understood, and it was something that I planned. So it wasn't something that I said, I need to take a month off now. This was a year in planning and saying, I really would like to take some time off in the future. What would need to be in place for me to do that? Again, when you have a great team that can back you up, other people will step up. So just, I would say plan, look around at your peers and see who can step in and help cover kind of your work while you're out, and explain why it's important for you and your wellness and your well-being, and that you're going to be a better employee and better teammate in the future in getting this time off.
Only piece I'd like to add to that is, thanks, Laura, would be to encourage you to perhaps do some research, find out what are the policies here at the University of Houston. Maybe perhaps have a confidential conversation with someone in HR to better ascertain those things prior to having the conversation with your boss. So that way you know what options are available, and then maybe they would be willing to help you explore those. So check with our great friends in HR.
Yes. And if you can't get a month, because I know there are some people who feel bad about taking a day, if you can't take a month and there's certain days of the week that you're just like sapped, just go ahead and plan and say, I'm going to take a Wednesday here or there. I'm going to take a Monday here and there, just to create a little bit of room. So we don't always have to have, a month or more, but just releasing a little bit of pressure for a day. Or if you can say, you know what, I'm going to take half a day here and there. Because I know there's some folks who are out there grinding it out and are logging sick days. They got 200 sick days just sitting. Take a couple of those sick days for your well-being. Emotional health is warranted, or a sick day is warranted for emotional health and well-being.
Yeah, and Dr. It's funny because I was looking at the chat and I think there's a few people that said, what if we don't have the luxury of taking time off? I mean, I'm a firm believer that everybody can take time, no, you'll be fine. The organization will be fine. The team will be fine. Things happen and others will step up and they like to do that. They want to help. So, happy to get into that discussion, but yeah, I'm a firm believer. It's really up to you. It's within your within your control.
Thank you, ladies. We do have another question from Professor Byron. He asked, I've always been taught that stress can be good as a motivator, for example, but how do we know when stress is becoming unhealthy?
That is such an excellent question. At the point, and let us also distinguish between stressor and stressful response. So stressor is the thing that happens, or the situation or the circumstance that can exceed your capacity to respond. So stress is about your capacity to be able to respond to the situation. So if you have what we call a maladaptive response, or some maladaptive responses, someone might go binge drinking. Someone might engage in some behavior that they think is helpful, but is actually adding to the problem. So at the point where your response to the situation isn't helpful, it doesn't allow you to continue to do your work. Maybe you have physical illness. Maybe some people just feel so overwhelmed that they're paralyzed, that stressor is too much. So I can appreciate people saying that it's a motivator. We'd have to have a follow-up conversation about that. But at the point where you're not able to do your work or to function at home, or places where it is important for you to be able to show up as most of yourself, then the stress is too much. It's just too much.
So we only had those 2 questions in the chat. If the audience has any more questions, please go ahead and type them in. Monique, I think that might be it.
Thank you so much. I have one little question, just in kind of briefly looking in the chat. If it's a very small department and you're just one person, that's it. I mean, if you leave, there's no one else. What kind of advice would you give if it's a very small department like that and you're the one person there? Is there a way to navigate that?
Can I float a perspective that is one of the things that can and honestly does happen for folks who get immensely overwhelmed and bogged down in their stress is serious health concerns. When you go to the doctor and they've ruled out everything else that's a source of your pain, and then they start to say things like, well, have you been under a lot of stress? And your response is, when am I not under a lot of stress? Like, there is a significant, the research is consistent of the stress response in the body, and how we have different kinds of serious concerns related to not managing stress. And so if we think about the fact that if you're not able to sufficiently manage your stress, and if things get too far out of hand, and if it gets to a really dire place, the person could end up being hospitalized. What happens then? So do you want to have to get to a place where your body physically shuts down in some place, or your mind shuts down in some way, and then find out what happens? I think the answer is probably no. And so we want to be able to just, whatever we need to do to stay far away from the cliff. Now, I know there are some folks who will dance with that cliff because they're thinking like, oh, you know, I can do so much and I can, in fact, do all the things. But I think we realized that we can. And one of the things that became very clear during COVID was that, you know, if you just undo one thing or one big thing, the whole system unravels. And so before we get to that place, why not invest in taking some time before you get to a place of, you know, of crisis even, you know, that we do whatever we need to do in order to be able to protect our minds. You know, one of the reasons that I introduced this language of psychological fortitude is because there are so many people who will say, well, I'm not crazy, so I don't see a mental health professional, or I'm not having a nervous breakdown. We don't want the nervous breakdown to be the threshold with which we decide that we need to be able to take care of ourselves. So just a difference in perspective.
Yeah, Monique, I would, you know, in answering your direct question around one person in a department, I mean, I really see that as you know, the accountability is on the leadership team of that department, right? Not the person working in that department. Certainly, you take great pride in the work that you do, but you should have peers and coworkers and other leaders that can step in, or there needs to be some form of backup plan because anything can happen. And so you could be out, and you know, the organization, the education services, whoever is running that department, is ultimately accountable for that. And so, you know, certainly documentation of the work that you're doing is important, right? Knowledge transfer. You know, we used to do sessions where we would do job role switch, where you would do somebody else's job for a week and you learn what they do. And that's a great way to get, you know, kind of backup plans in place. So there's creative ways in doing that. Versus, you know, I'm the only one that has this information. I'm the only one that knows how to do this job, right? I mean, at some point, that person may or may not leave the organization, and you have to figure it out. So I would put the accountability back on the leadership team to put those plans in place.
Thank you so much. I just want to say one more time, because I can't say it enough today. This was a phenomenal conversation. I want to say thank you to our panelists for taking the time to share your stories, your perspectives, your experiences. And to close, and actually, if anyone wants to use an emoji to give our panelists a hand clap, that'd be awesome. But to close, I want to welcome our UH Staff Council President, David Frankfurt, with some important information for our UH staff.
Good afternoon, everybody, and thank you for participating in today's Staff Council Workplace Conversation presented by our Diversity, Equity, and Inclusion Committee. A couple things I want to bring up is a reminder, if you're looking to volunteer, we're always looking for volunteers to join Staff Council. There's a link on our website as well as our monthly newsletter, Staff Council Connect newsletter. We also have upcoming events to let you know about. Next slide. We have a staff council mixer this Friday night at Poor Behavior, free parking, and half price on pizzas. And everybody is welcome. Will be scheduled on Wednesday, July 19th this summer. Next slide. And a reminder, we have our Staff Council All Paws In campaign. If you would like to donate, we have some great initiatives from Cougar First Impression, staff development, reimbursement, student success, scholarships, and community outreach.
conversation series. I am so excited. It's been a great event. All of the panelists have been amazing. Thanks to all of you for being with us this afternoon. Thanks to Laura Ortman. And for those of you who may not know, this is our very own Staff Council President's sister. So this is David Frankfurt's sister. Do you see the resemblance there? Thank you so much, Laura. It's been amazing. Thanks for being here. Also, thanks to my dear friend, Miss Angela Cox. I met Miss Angela probably 25 years ago when I lived in the Virginia, DC area. We've been friends for a long time. She's like, I say, my sister from another mother. I love her. She's amazing. We're the besties. So thank you so much, Miss Angela, for being here. And of course, to our very own University of Houston panelists, thanks so much to Dr. Rheeda Walker for joining us this afternoon. It's been amazing. And Dr. Erika Henderson, thank you both so very much. I hope that everyone is excited and pleased with the conversations we've had this afternoon as much as I have been. And we hope to do this again and maybe have you all come back next year and do it all over again, right? This has been amazing. Thanks to all of our participants for being here. Again, the event has been recorded and we will make that available for anyone who missed the beginning or would just like to see it all over again. Again, thanks to the Staff Council Committee, the DI Committee, and thanks to all of the U of H staff. We just really greatly appreciate y'all being here to support the UH Staff Council and the DEI Committee. Thanks to my co-chair. I don't know if we had a chance to say hello to Callista Brown. She's also my co-chair for the committee. Hi, Callista. There you are. Thanks so much. Again, I really appreciate you all being here. Great conversation on HERStory to close out the month of March, Women's History Month. What better event than to have a HERStory event that we've had this afternoon? Thanks again. And of course, we always say thanks to UH staff. As always, the Staff Council stands for all of you. So thanks. Have a great day. Have a great rest of the week. Enjoy. Stay in contact with Staff Council. You can see here by our link that you can always reach us and stay connected with Staff Council. And yeah, it's just been amazing. Thanks, everybody. Have a great day. Thanks to our panelists. You guys are amazing. Thanks to all of our participants.
Bye.
Bye. And thanks to our moderator.
Don't forget to download the roster.
Okay.
Great job, everyone. Loved this.
This was
Awesome
great,
event.
right? Amazing.